smile and frown. Hi, Emma.
Hi.
I'm Dr. Matt. I'm going to do your exam today.
Nice to meet you.
Nice to meet you too. Go ahead and verify your last name and your date of birth for me, please.
Yeah, Archbold, Archbold, and my date of birth is 12/01/02.
Do you have any allergies?
Not that I'm aware of.
Okay. Are you experiencing any pain at the moment?
I have a little bit of neck and shoulder pain and some mild heartburn.
How long ago did the pain start?
Probably a month ago.
Okay. And is it intermittent? Does it come and go, or is it constant?
It's constant.
On a
It's hard to sleep at night.
Oh, okay. On a scale of 0 to 10, 0 being no pain, 10 the worst pain, how would you rate it right now?
Right now, a 6.
And is it sharp, dull, or achy? How would you describe it?
Like a sharp ache.
Does it radiate more on one side, or is it central, or on both sides equally?
Both sides equally.
Tell me a little bit more about the heartburn. When did it start as well?
Yeah, it started about a month ago. I started doing more yoga, so maybe there's a correlation there. I don't really recall any dietary changes.
Is the heartburn more after you eat, when you wake up, before you go to sleep?
It definitely is worse in the morning. And does flare up after I eat.
Okay. Are you experiencing any frequent headaches?
Yes.
Okay. How often?
I'd say once a day.
Okay. Are you taking any medicine for that?
Just ibuprofen.
And for how long have you been experiencing these migraines?
I thought they were normal, so maybe like 2 or 3 months.
Okay. Have you noticed any changes in your vision? Any loss of sensation?
No.
Are you experiencing any pins or needles in your fingers or toes?
Yes, in my left hand. In my hand. Yeah.
Okay. And which fingers are you referring to?
It's mostly like my thumb and my ring finger, I think.
Okay. Any surgeries or accidents in the last 12 months? Are you taking any medications besides ibuprofen?
Sometimes I take that like an antacid for the heartburn.
Okay.
And also birth control.
Okay. And does that alleviate?
Yes.
Okay.
I like the fruity flavors.
Okay. And for how long have you been on the birth control?
A couple of years.
When was your last gynecology exam?
A year ago?
Okay, what about your pap smear?
A year ago. I think it was the same appointment.
Okay. And do you remember when you had your last period? Approximate?
I think about a month ago.
Okay. Have you noticed any difficulty breathing or changes in your heart rate, any palpitations or rhythmic beatings in your chest?
Sometimes with the heartburn, yeah.
Do you have any family history of heart disease?
I do.
Okay. Mom or dad's side?
My dad's side.
Okay. Any history of thyroid disorders?
No, not that I know of.
Nor in the family, correct?
Correct.
Okay. Are you experiencing any weakness in your arms or legs?
Yes, in my arms.
Both or just one?
Both.
Okay. Do you have difficulty grasping objects?
Sometimes when I get the pins and needles in my ring finger and my thumb on my left side, it does
Okay.
spasm.
And when did you first notice this? Do you remember?
I don't know, it's been a while.
Okay. All right. So I'm going to start the cranial nerve exam and do some sensory tests to rule out any nerve damage.
Okay.
And also we'll do a full head to toe on top of that, just so that we are able to rule out anything else.
Okay.
I'm going to put my gloves on. I'm going to take your temperature first. This will go on your forehead. Any flu-like symptoms?
No, just the soreness.
This will go on your index finger. Go ahead and relax. Okay. Blood pressure is within normal limits, 118/65. Oxygenation is 72% on room air. Heart rate in the 60s. I didn't notice your hands being very cold. Is that normal for you?
Yes, I have terrible circulation.
Okay. And do you have the same, are your feet cold as well?
Yeah,
For how long have you been experiencing this?
my whole life.
Okay. So let's go ahead and continue the exam. I'm going to do a vision check. Do you wear contacts?
I do.
Okay. When was your last vision check?
A year ago.
And your last prescription?
A year ago.
Okay. Let's go ahead and look straight here at my nose. I'm going to flash a light in your eyes. Very good. Go ahead and follow my fingers with your eyes only. Don't move your head. Are you experiencing any pain? No. Okay. Go ahead and look right here at the light. I'm going to bring this pen light very close to your nose. Go ahead and keep on looking at the pen light. Good. Now just do that one more time. Okay. Any pain or pressure?
No.
Okay. Go ahead and look right here. Go ahead and look right here. A little bit higher. Let's go ahead and do that one more time here. Okay. Go ahead and give me one big ah. Any pain with swallowing? Okay. Tongue is symmetric and pink in color. Go ahead and give me a big smile and frown. Puff your cheeks. Keep them puffed for me. Don't let me unpuff them. Good. Go ahead and relax. I'm going to try to turn your head towards your right. Don't let me do that. One more time. A little bit weak on that side. Go ahead and the same thing. Okay. Stronger there. Just going to push down on your shoulders. I'm going to have you shrug your shoulders now. Okay. Go ahead and squeeze my fingers as hard as you can. Go ahead and just grab my fingers and I'm like in a fist. Okay, that's good. Go ahead and put your arms in front of you. Have you noticed any shakiness or trembling?
A little in the...
Okay. I am noticing a little bit of redness towards the tip of the fingers. Let's go ahead and check a capillary refill. It is a little bit delayed. We want to see it within 2 seconds. Okay, go ahead and try to keep your arms straight. I'm going to push it down. Don't let me do that. Same thing. I'm going to do this both in the same time now. Okay, I'm going to try to open your arms. Don't let me do that. First, I'm going to do left. Good. Right. Both in the same time. Okay. Now I'm going to try to push it up. Go ahead and tell me if you feel any pain. Resist. Resist. Good. Resist. Resist. Okay. Go ahead and relax. Okay. I'm going to listen to your lungs and heart. I'm going to have you take a deep breath in through your nose and out through your mouth. Take another deep breath in through your nose and slowly exhale. One more time. And breathe out. Okay. Now I'm going to listen to your heart. Go ahead and breathe normal. I can hear S1 and S2. And S3 as well. Usually we don't want to hear S3 or S4, but I think there is an S3 on your rhythm. And sometimes people can just be born with this and have nothing to worry about. So we're just going to do a few more tests. Okay. I'm gonna have you turn the other way so that I can take a look at your neck and shoulders, and I'll listen to your lungs in the back as well. Okay. I'm going to take a look at your spine. Slowly palpating cervical spine. Just noticing a little bit of redness right at the base. It does seem to be superficial. I'm not noticing any edema. Palpating the lymphatic system. I'm not noticing any changes in temperature or volume. I'm looking for any abnormalities in the curvatures of the spine. Normal scoliosis or lordosis is expected. I'm not feeling any things swollen around the paraspinal muscles. I'm going to take a few measurements. We're looking for any asymmetry, something that would indicate a degree of inflammation. about the fingertips? Do you want to L1? Not 67. Just going to repeat that measurement to make sure that we have it correct. But it seems like there is just a 1 to 2 degrees difference. It's very insignificant. This is going to feel a little bit cold. Just going to measure for any swelling. Slight swelling on the right side. Let's start with T1. Right scapula is indeed a little bit lower than the left. Going to listen to your lungs. Go ahead and take a deep breath in through your nose. And breathe out. And again, breathe in. And breathe out. Again, breathe in, breathe out. Again, breathe in, breathe out. I can go ahead and just breathe normal now. I'm going to do a few more tests. Go ahead and tell me if you feel this on the left or right of your back. The right. Left. Right. Left. Right. Left. Right. Left. Okay, I'm going to look for any deviations in heat disturbances around the spine level, and I will mark those points so that we know exactly where we need to focus on. There are only 3 points that seem to need adjustment. I'm going to touch you with 2 textures. One is going to feel dull. This is what dull is going to be like. And the other one is going to be sharp. This is what the sharp is going to be like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Go ahead and tell me if you feel this dull all the way down.
Yes.
And does this feel sharp all the way down? Any numbness?
No numbness.
Okay. What about now? Does this feel dull all the way up?
Yes.
And does this feel sharp all the way up?
Yes.
Okay, I'm going to do a micro adjustment here. It's going to relieve any pain and tension. It's going to help with spinal movement. Okay. I'm gonna have you change into this gown and I'll have you relax on the table and we'll do a full body head to toe examination. Okay. I'm going to touch your temples. I'm looking for any tension. And sinuses right in between the eyebrows. And right under your eyes. not noticing any puffiness or swelling. I'm going to palpate your lymphatic system, looking for any lymphadenopathy. Palpating preauricular lymph nodes. And postauricular lymph nodes. Moving down to the cervical plexus. Supplemental lymph nodes under the jaw. Going to test your reflexes. Go ahead and relax your jaw. Good. Go ahead and tell me if you feel this vibration. Do you feel this?
I feel it.
Okay, go ahead and tell me when it stops.
It stopped. 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 It stopped.
Okay. Which position here is louder? Position 1 or 2?
2.
1. 2.
1.
I'm going to take a sample. We're looking for any mycobacteria that could trigger neurological symptoms. We're going to send this to the lab. Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 2. 2. 2. 1. 1. 1. 1. 1. 2.
Do you feel this cold or warm?
Cold.
Do you feel this cold all the way up?
Yes.
Okay. What about now? Does this feel cold or warm?
Cold.
Does it feel cold all the way up?
Yes.
Okay. Go ahead and tell me if you feel this cold or warm.
Warm.
And now?
Cold.
Okay. Do you feel this warm all the way?
Yes.
And now?
Yes.
Do you feel this equally on both sides?
Yes.
Do you feel this equally on both sides?
Yes.
And this?
Yes.
Okay, I'm gonna have you open your mouth and close. What does it taste like?
Nothing.
Okay. That was the control test. Go ahead and open again. And close. And open. What does that taste like?
Nothing.
Okay. Go ahead and check your smell. Go ahead and take a deep breath in through your nose and out through your mouth. Let me know if you need to do that one more time.
One more time.
Okay. Are you able to identify the smell?
It's sweet like lavender.
Great. Let's go ahead and do that. On the other side, go ahead and take a deep breath in through your nose. Would you like to smell one more time?
Please.
Breathe in through your nose. What does that smell like?
Maybe eucalyptus or pine.
Okay. I'm gonna turn your head to the left. Just take a look behind your ear. Skin looks intact. I'm not noticing any redness. Epidermis is well perfused. I'm going to check your scalp. We're looking at your distribution, any signs of alopecia, eczema, psoriasis. I'm going to do a few tests here. I'm going to touch you with two objects. One is going to feel sharp and the other one is going to be dull. This is what sharp is going to feel like, and this is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Sharp.
Do you feel this sharp all the way?
Yes.
Does this feel dull all the way?
Yes.
Okay. I'm going to attach a neutralizer to the hair follicle so that we can collect a sample. Now go ahead and tell me if you feel this 2, 1, or 3 pressures.
1.
1. Okay.
1. 2. 1. 2. 2.
going to do a lymphatic massage around the ear and behind it. This is going to help stimulate blood flow to the scalp. It also helps to remove any toxins that have been accumulating in the lymphatic system. Going to turn your head just facing up. Going to check your trigeminal nerve. I'm going to just apply gentle pressure right here on your TMJ. Go ahead and slightly open your mouth. Any pain when you do that?
No.
Okay. Now I'm going to have you open it slowly as much as you can. Good, and slowly close. Okay. I'm not feeling any popping, which is great. Let's go ahead and do that just one more time. Okay, go ahead and close. Alright, I'm just gonna look now for any microscopic sounds that are really hard to distinguish. So this is gonna go just right here in front of the ear. Go ahead and slightly open your mouth one more time, as much as you can, and gently close. Okay, just a little bit on the right side. I would say you're at the maybe 2nd degree there. Go ahead and slightly open again. And close. Okay. Palpating scalp for any lumps to see if there are any asymmetries. Scalp is very mobile, which is absolutely great. Do you drink coffee?
Yes.
Okay. No signs of mastoiditis. Alright, I'm going to go ahead and move down to the abdominal assessment. Okay, Emma, I'm just going to first listen to your abdomen, see if there are any abnormal sounds before we even touch it. So just go ahead and relax. Is it okay if I lift the sports bra a little bit higher? Okay. I'm just gonna have you put your arm here, relax. Okay, this is gonna feel a little bit cold. We're starting with the right upper quadrant. Okay, moving to the right side. Okay, so the superior abdominal area sounds good. Now I'm moving to the lower part. Left lower quadrant is within normal limits. Moving to the right lower quadrant. A little bit diminished on the right side. I'm going to do a few tests. This is a solution that helps to neutralize a sensation. I'm going to draw a letter. Go ahead and tell me what letter you feel.
R. M. Good. G.
1 out of 4. Okay, I'm going to wipe the solution off. I'm going to go ahead and just slowly percuss. Please let me know if you feel any type of tenderness. Sometimes this movement can elicit some pain or tenderness, and we want to make sure that we are aware of it. Very normal sounds there. I'm going to listen to your abdominal aorta. We're looking for any buoy. Just going to slowly palpate. Let me know if you feel any kind of pain. This palpation is just very superficial. Okay, let's go ahead and have you turn over and I will do another back exam. Okay, I'm going to first palpate to make sure that there is no swelling around the cervical vertebrae. No signs of scoliosis or lordosis. Very normal curvatures within normal limits. I'm going to listen to your spine. You want to make sure that there are no microscopic sounds. go ahead and tell me if you feel this 2 or 1 pressure point.
1. 1. 1. 1. 1. 1. 2. 1. 2.
Okay, go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Go ahead and tell me when you don't feel the vibration anymore. And please let me know if you feel this cold or warm.
One. Cool.
Do you feel this warm all the way? Do you feel this cold all the way? What about now? Sorry, what about now? Does this feel cold? Okay. Does this feel the same as this? Does this feel the same as this? Alright, I'm gonna have you sit back up and we're going to discuss the results. Okay, Emma, I do recommend that we get an MRI of the chest and neck just so that we rule out anything serious, but the health physical exam turned out to be really good. I didn't see any abnormalities. Everything was within normal limits. Even that you had a little bit of sensitivity or numbness in certain areas that could also be triggered by seasonal allergies or something like that. So we're gonna run a blood panel. And the CT. Do you have any questions for me? No. Okay, great. I'm gonna have my assistant reach out to you with the results and we'll let you know how everything is going. Thank you.
Thank you. It's like minty or eucalyptus. That one's really sweet.
Okay, I'm going to sanitize my hands and take your vital signs. This will go on your forehead. I'm going to check your temperature, 98.2 Fahrenheit. Very good. And I'm going to put this on your index finger. Relax. All right, we're going to take your blood pressure. This is going to go on left upper arm. arm. I'm going to measure your blood pressure. I'm going to have you relax. Blood pressure is normal, 110/67. And heart rate 66, oxygenation 98% on room air. Okay, we're going to go ahead and continue with the exam. I'm going to have you change into this gown, and then we're going to have you lay down and we're going to begin the exam. Okay, I'm going to start with a physical touch. We're going to palpate, starting with the face. You did mention that you're having some difficulty with feeling and sensory perception around the jaw area. So we're checking for any lymphadenopathy, lumps or bumps, and for asymmetry. Sinuses are intact. Not feeling any extra fluid. Palpating the neck area. No lymph node enlargement behind the ears and the back of the neck. definitely going to palpate the head and the scalp area. Mastoid bone is non-tender, not noticing any redness or swelling, no signs of mastoiditis. Going to compare with the right side. Okay, now that you're with your eyes closed, I'm going to check your olfactory nerve. So go ahead and take a deep breath in through your nose and tell me if you can identify the smell.
It's like minty or eucalyptus.
Good. I have here another scent.
That one smells like garlicky.
Garlicky. That's good. Oopsie. And I have here one more scent.
That smells like chamomile.
Very good. So yeah, it was herbal. And since you are here, we're going to check your taste as well. So this is a piece of paper that I'm going to put on your tongue. And I'm going to have you identify what it tastes like. This is going to go on your tongue. Go ahead and open.
Kind of tastes like citrusy.
Okay. Okay, go ahead and open and tell me what this tastes like.
Bitter, kind of like coffee grounds.
Good. Okay, and I have here one more.
That one's really sweet.
Okay. Perfect. I'm going to take some measurements. I'm going to check for asymmetry to see if there is any level of inflammation. neurological seems to be a little bit enlarged. I'm going to go ahead and listen. Okay. Go ahead and take a deep breath in and hold it in for 1, 2, 3. Breathe out. And again, take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. So I did hear a brewy, just not on the normal side. Okay, I'm going to do a test around the neck and the jaw area. Go ahead and tell me when you don't feel this vibration anymore. So it seems like there's less nerve conduction on the left shoulder. I'm going to check your reflexes. Go ahead and relax your jaw. A little bit more. Good. Okay. Go ahead and tell me if you feel this 2 or 1 pressure point.
2. 2. 2. 2. 2.
Okay, go ahead and tell me if you feel this on the left or right.
Left. Right. Right. Left. Left. Right. Middle.
Okay. Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
And this the same as this?
Yes.
Okay. Does this feel cold or warm?
Cold. Cold. Warm. Warm.
going to take a look inside your ears. Go ahead and turn your head towards the right. This one's just going to feel a little bit cold. We're just visualizing the tympanic membrane. There are no signs of cerebrospinal fluid leakage. Okay, go ahead and turn your head towards the left. No fluid buildup. Tympanic membrane is dark gray. Margins are well defined. Okay. I'm going to listen to your heart. I'm going to slide the stethoscope under the gown. You can go ahead and breathe normal. Okay, I'm going to check for murmurs. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. And now take a deep breath in and then exhale. And again, breathe in and exhale. Okay. Let's go on and check your scalp. Have you noticed any itchiness or lumps around the scalp?
No itchiness or lumps, just kind of drier scalp.
Drier scalp. Okay, so let's check for any skin disorders or neurological deficits. Go ahead and tell me how many taps you feel. 1, 2, or 3.
2, 2, 2, 1.
Okay. Do you feel this 2 or 1 pressure point?
1, 1, 2, 1, 2, 1, 1, 1.
And does this feel sharp or dull?
Can you do it again? Dull,
What about now?
dull, dull, dull.
And does this feel sharp or dull? You can't really feel it, right?
No,
Okay, because I touch the scalp constantly and it doesn't seem to react. No feeling whatsoever to the dull sensation here. So I'm going to take a sample to see if there is any fungal growth. I'm going to apply a basic solution. It's going to help to neutralize the skin cells that we are removing. We are going to send this to the lab. Does this feel cold or warm? Warm. What about now?
Cold.
And now?
Cold. Cold. Cold.
Go ahead and tell me if you feel this 1, 2, or 3 taps.
1, 2, 2, 3.
Do you feel this 2 or 1 pressure point?
1, 1, 1, 1.
And does this feel sharp or dull?
Dull. Dull.
What about now?
It's dull.
But you can feel it better than
Yeah,
when we touch here.
yeah, when it's closer to my forehead.
I'm noticing a little bit of redness on the left side. It seems like it extends from top of the ear. The scalp looks healthy. A little bit of oily sebum production on that side. Noticing the same redness side. It might explain the itchiness that you've been experiencing. Okay. We're going to take a look at your abdomen. Okay, we're going to start with the left kidney, so I'm just going to palpate using a circular motion to see if there's any tenderness. And slowly I'm going to compare. Okay, now that we moved things around, I'm going to listen. This is going to feel a little bit cold. I'm going to progress, starting with the left upper quadrant. I'm going to take some measurements, checking for abdominal distension. When was your last ultrasound?
I believe 3 or 4 months ago.
8.9. So I would say about 2-degree difference from left to right. Okay. Go ahead and tell me if you feel this sharp.
I do.
Do you feel that sharp all the way?
Yeah.
What about now?
Yeah. 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 Yes. Yes.
Does this feel dull or sharp?
Dull. 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 Dull.
Okay. Okay, this is gonna go on the hip bone on the left side. Can you feel that vibration?
Yeah.
Tell me when it stops.
No.
Okay. Now this is going to go on your intercostal. Can you feel that vibration? Tell me when it stops.
No.
Okay. Now we're going to be on the right hip. Do you feel that?
Yeah.
Tell me when it stops.
No.
And right intercostal C5. Do you feel that? tell me when it stops. Okay. All right, let's go ahead and check your back. Okay, I'm going to palpate the cervical spine. We're looking for signs of inflammation. Just slowly trying to move the vertebrae to check the mobility. Slight curve towards the left at the last thoracic. Scapulas are midline. Paraspinal muscles are well vascularized. We're going to check hydration status. Just checking some asymmetry. We want to make sure that both parts are equal. It's going to feel a little bit cold. I'm going to have you identify the shape that I'm drawing. So now I'm just applying the gel. Okay, so I'm going to draw a shape. Go ahead and tell me if you can identify it. Circle. Okay, what letter am I drawing? What about now? this is going to feel a little bit cold. Okay, we're going to check spinal reflexes. Any pain there?
No.
Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Can you do that one again? Dull. Sharp. Dull. Dull. Sharp. Dull. Dull.
Okay. Seems like there is a conductory problem here around the scapula. We can go ahead and run some more tests and see how the results come out. There's definitely a little bit more inflammation on the left side. Okay, Angelina, so everything looks good. We're just gonna run some tests to make sure that everything is normal. You did have some sensitivity on the left upper side. We're gonna run a chest CT. And for that, we're gonna have you come sometime in the morning after you rested and you had breakfast. So the image does look normal. And otherwise, we're gonna probably take some samples as well, just to rule out anything. And we're gonna call you back with the results.
Okay.
All right, you're welcome. Thanks for coming in. finally, I'm going to put gloves on and take a look at your scalp. Okay, I'm going to take a look at your ears and see if there is any need for ear cleaning, or if we notice anything that's a little bit irritated or red. So I'm just going to first palpate and see if I feel any type of nodules. Palpating behind the ear. Not feeling any swelling, fluid buildup. Okay, let's take a look on the other side. And the skin looks healthy. Noticing a little bit of dryness behind the earlobe.
Mm-hmm.
Okay, I'm going to start with the right ear. First, I'm going to apply a basic solution that helps to bring down the acidity of the skin. It is lavender scented.
Mm.
going to feel a little bit cold. Let's take a look at the other side.
Okay.
Okay, we're going to apply the same toner. This is going to feel a little bit cold. It does provide a pH balance to the skin. We're applying a gentle exfoliator that helps to remove debris and soften the skin. feels a little bit better, a lot smoother, and I can already tell the increased circulation in this area. I'm gonna have you flip over on your belly and I'll take a look at the back of your scalp. Ready? Going to take a look at your scalp and behind the neck hairline. I'm going to be looking for asymmetry, any redness. Is it okay if I remove the necklace? Okay. Going to start by palpating C1. This space right here needs to be very fluid so that we allow for good circulation. Looking at spine mobility and how it aligns with the scalp. I'm not noticing any redness. The skin looks well perfused. No raised bumps. So I would say overall normal circulation. normal hair pattern. Noticing a little bit of changes in the texture as we're moving up to the crown. And you did say in your file that you're experiencing itchiness that comes and goes. Going to take a look and see if we can determine the root cause. Noticing some dandruff at the base of the crown, and then it's just some patches that we can definitely test and see what we're dealing with. It could be small inflammation or bacterial overgrowth. I'm going to take a sample. First, we're going to lower the acidity so that we can collect as many cells as possible. I'm going to spray this only on the parts that we want to collect. Take a look behind the ear as well, and the right right side. We want to see if we're noticing the same pattern. Looking at the scalp. I'm looking at the scalp elasticity. It seems like there is a little bit of tightness. Here, just a small bump. There's a little bit more inflammation on the right side. Can develop a treatment that increases circulation. The hair follicles look healthy. We just need to maybe increase the acidity so that we allow for a normal pH. hair distribution. No signs of alopecia. I'm going to apply an ashwagandha serum. It helps to lower inflammation. To apply it and just stimulate the skin. focusing on the hairline. Just a soft scalp stimulation so that the nutrients are easily absorbed. Do an anti-inflammatory neck and hairline massage. To apply a serum that helps to decrease inflammation. To do a lymphatic massage. This helps to decrease fluid buildup and reduces swelling around the hairline. to apply an anti-inflammatory oil. Focusing mostly on trapezius muscle. Just applying some deep pressure therapy to relieve those deeper muscles.